12 medications that make you gain the most weight. Did you know that the medications you take can be directly linked to your weight gain? Could the medicine you're using be one of the main contributors to this increase? More importantly, how might they affect your health in the long term? These are crucial questions for anyone noticing changes in their body and wanting to understand the possible causes behind it. Medications are essential for treating diseases, but some can have unexpected side effects, like weight gain. Can you identify if your medication is one of the biggest culprits? Sometimes the answer might be closer than you think, and the solution could be as simple as talking to your doctor. Have you ever stopped to think about how these medications influence your metabolism? Stay with us until the end, because medications 6 and 10 are the ones that cause the most weight gain, and few people know about this. Let's get started. Medications that cause weight gain. Anyone who has read a medication's insert knows that the long list of side effects can be overwhelming. Often you might think about giving up the medication altogether, and a common side effect in these cases is weight gain. That's why it's important to know the 12 medications that cause the most weight gain. If you've noticed bloating or an increase on the scale while taking one of these drugs, it's essential to talk to your doctor to explore alternatives. Is the medication you're using on this list? Some cases might surprise you. How can medications cause weight gain? Medications can cause weight gain in 5 main ways. 1. Increased appetite. Some medications stimulate your appetite, making you eat more and consequently gain weight. 2. Changes in glucose metabolism. Certain medications alter how your body absorbs and stores glucose, leading to increased abdominal fat, higher triglycerides, and even diabetes. 3. Reduced metabolic rate. Some medications slow down your metabolism, meaning calories are burned more slowly, which makes weight gain easier. 4. Decreased exercise. Tolerance. Medications can reduce your ability to exercise, causing fatigue and shortness of breath, which can make it harder to stay active. 5. Fluid retention. Many medications cause swelling, leading to water retention. This increases weight, but not necessarily fat mass. How much weight can someone gain due to a medication? The amount of weight gained varies from person to person and depends on the medication. Some people might gain just a few grams over the years, while others can gain 10, 20 or more pounds in just a few months. It's important to remember that many of these medications treat chronic diseases, and the illness itself can contribute to weight gain, making it hard to know what came first, the chicken or the egg. For example, depression itself can cause weight gain, and so can some antidepressants. We know that weight gain can lead to insulin resistance, prediabetes, type 2 diabetes, high blood pressure, high cholesterol, high triglycerides, sleep apnea, fatty liver disease, hepatic steatosis, kidney problems, difficulty getting pregnant, heart attacks, strokes, and even cancer. Therefore, we must avoid weight gain. However, if you find that the medication you're taking is on the list of those that cause weight gain, never stop taking it without consulting your doctor first. Only they can decide whether it's possible to adjust the dose or switch medications. Never stop treatment on your own. What are the 12 medications that cause you to gain the most weight? 1. Antihistamines. If you've ever had allergic rhinitis, cold symptoms, hives, or other allergies, you've likely been prescribed an antihistamine such as cetirizine, fexofenadine, Allegra, or desloratadine. Studies show that these medications can increase weight and abdominal circumference, especially if taken regularly. People who use antihistamines are 55% more likely to be overweight or obese compared to those who don't. This happens because histamine reduces hunger signals, and by using antihistamines, you might feel hungrier and also have difficulty recognizing when you're full. Additionally, antihistamines can cause drowsiness and reduce motivation for physical activity, contributing to weight gain. It's important to note that not all antihistamines cause weight gain, and this effect can vary from person to person. However, if you are using antihistamines regularly and have noticed unexplained weight gain, it's advisable to talk to your doctor about alternative treatments. 2. Tricyclic antidepressants. Amitriptyline, used to treat depression, fibromyalgia, chronic pain, and migraines, is associated with increased appetite, especially for sweets. This effect occurs due to the medication's antihistaminic activity, which also causes drowsiness. Therefore, tricyclic antidepressants are more related to weight gain than other antidepressants or migraine medications. Additionally, these medications can increase the QT interval, affecting heart rhythm, cause orthostatic hypertension, and increase heart rate. A 2006 study revealed that 30% of people taking amitriptyline gained more than 5% of their body weight in 5 months. Amitriptyline is a tricyclic antidepressant that works by increasing levels of serotonin and norepinephrine in the brain, neurotransmitters responsible for regulating mood and appetite. However, its mechanism of action can also lead to unwanted side effects, such as weight gain. In addition to increasing appetite, amitriptyline can cause fluid retention and a decrease in basal metabolism, contributing to weight gain. These effects may be more pronounced in individuals with a genetic predisposition to weight gain or with unhealthy eating and lifestyle habits. 3. Corticosteroids. This is a group of medications you probably expected to see on this list. Corticosteroids like prednisone, prednisolone, methylprednisolone, and dexamethasone are used to treat asthma, allergies, arthritis, sinusitis, and inflammatory bowel diseases because they help reduce inflammation. Prolonged use is associated with increased appetite, fluid retention, and changes in metabolism, making it difficult to control weight gain. A 2006 study showed that between 60% to 80% of people who take corticosteroids long-term gained weight. Corticosteroids are hormones naturally produced by the adrenal glands, but they can also be synthesized in the laboratory for medicinal use. They act in the body by regulating the inflammatory and immune response, which makes them effective in treating various conditions. However, prolonged use of these medications can lead to significant side effects, including weight gain. Other adverse effects associated with long-term corticosteroid use include osteoporosis, diabetes, hypertension, mood changes, increased risk of infections, and eye problems such as cataracts and glaucoma. For this reason, it is essential that the use of these medications is always supervised by a doctor, who will assess the need and appropriate dose for each patient, as well as monitor for possible side effects. 4. Antihypertensives. Among blood pressure medications, 2 main classes are diuretics and beta blockers. Diuretics like furosemide and hydrochlorothiazide help temporarily reduce weight by reducing bloating, but the body may interpret the thirst caused by these medications as hunger, making you eat more. Beta blockers like atenolol can reduce your heart rate during exercise, making the body burn fewer calories. Antihypertensives are essential for controlling high blood pressure, a condition that increases the risk of cardiovascular diseases such as heart attack and stroke. However, some of these medications can interfere with metabolism and appetite, leading to weight gain. In addition to diuretics and beta blockers, other classes of antihypertensives can also be associated with weight gain. Calcium channel blockers, such as nifedipine, can cause fluid retention and increased appetite. Meanwhile, angiotensin-converting enzyme inhibitors, ACE inhibitors, such as captopril and enalapril, may lead to slight weight gain due to fluid retention. It's important to emphasize that despite the possible side effects, controlling high blood pressure is essential to prevent serious complications. Therefore, you should not stop using these medications without medical guidance. 5. Birth control. Not all contraceptives cause weight gain. Pills like Diane, Yaz, and Yasmin have little chance of increasing body fat but can cause fluid retention and bloating. On the other hand, injectable medroxyprogesterone, Depo-Provera, is associated with weight gain, especially in young women who are already obese. Studies show that these women are more likely to gain weight with the use of medroxyprogesterone. Hormonal contraceptives are widely used to prevent pregnancy and treat conditions such as acne, endometriosis, and polycystic ovary syndrome. However, many women fear that these medications may lead to weight gain, which can be a reason for discontinuing use. It is important to note that the response to contraceptives varies from woman to woman, and not everyone will experience weight gain. Additionally, the weight gain associated with some contraceptives may be attributed to other factors, such as lifestyle changes, diet, and physical activity levels. Women who are already overweight or have a history of weight gain with contraceptives should discuss with their doctor the most suitable options for their case. There are many types of contraceptives available, with different hormone combinations and dosages, allowing for individualized treatment. 6. Other antidepressants. Paroxetine is an antidepressant from the selective serotonin reuptake inhibitors, SSRIs class. Although most SSRIs do not cause weight gain, paroxetine is an exception, as it can increase appetite, leading to weight gain early in treatment. Mirtazapine, Remeron, is another antidepressant that can cause weight gain, despite increasing levels of serotonin and norepinephrine, substances typically linked to weight loss. Its antihistaminic effect is responsible for the increased appetite and drowsiness. Antidepressants are essential medications for treating mood disorders such as depression and anxiety. However, some of these drugs can lead to undesirable side effects like weight gain, which can affect treatment adherence and patients' quality of life. In addition to paroxetine and mirtazapine, other antidepressants are also associated with weight gain. Tricyclic antidepressants, such as amitriptyline and nortriptyline, can cause significant weight gain due to their anticholinergic and antihistaminic effects. Monoamine oxidase inhibitors, MAOIs, such as phenelzine and tranylcypromine, can increase appetite and lead to weight gain. It's essential for patients undergoing antidepressant treatment to be aware of possible side effects and discuss any concerns with their doctor. In some cases, it may be necessary to adjust the dose, switch to another medication, or adopt strategies to minimize weight gain, such as exercising and maintaining a balanced diet. Additionally, it is crucial that patients do not discontinue the use of antidepressants without medical advice, even if they are concerned about weight gain. Abruptly stopping these medications can lead to withdrawal symptoms and a return of depression or anxiety symptoms. 7. Epilepsy medications. Medications like sodium divalproate, Depakote, pregabalin, Lyrica, and gabapentin, used to treat epilepsy and bipolar disorder, can increase appetite. A 2007 study revealed that nearly 50% of women and 25% of men taking Depakote gained 25 pounds in 1 year. Interestingly, the effect appears to be more common in women. These medications are known as mood stabilizers and anticonvulsants, widely prescribed for treating neurological and psychiatric conditions. However, weight gain is a common side effect and can be particularly problematic for patients who are already overweight or have difficulty controlling their food intake. The exact mechanism by which these medications cause weight gain is not fully understood, but it is believed to be related to changes in glucose and lipid metabolism, as well as an increase in appetite. Additionally, some of these drugs can cause fluid retention, contributing to weight gain. Interestingly, weight gain associated with these medications seems to be more prevalent in women than in men. This may be due to hormonal and metabolic differences between sexes, as well as psychosocial and behavioral factors. To minimize the weight gain associated with these medications, patients should be advised to follow a balanced diet, exercise regularly, and monitor their weight. In some cases, it may be necessary to adjust the dose or consider alternative therapies that have less impact on body weight. It is crucial that patients do not stop using these medications without medical advice, as abrupt discontinuation can lead to severe adverse effects, such as seizures or the recurrence of bipolar disorder symptoms. Any concerns about weight gain should be discussed with the physician overseeing the treatment. 8. Mood stabilizers and antipsychotics. Lithium, used to treat bipolar disorder and severe depression, can cause significant weight gain. Up to 65% of patients who take lithium gain more than 22 pounds after years of use. Olanzapine, Zyprexa, is one of the antipsychotics with the greatest potential for weight gain, in addition to worsening glucose, cholesterol, and triglyceride levels. Other antipsychotics that can cause weight gain include risperidone, quetiapine, Seroquel, and clozapine. Lithium is one of the most effective medications for treating bipolar disorder, helping to stabilize mood and prevent manic and depressive episodes. However, weight gain is a common side effect and can significantly affect patients' quality of life. The mechanism by which lithium causes weight gain is still not completely understood, but it is believed to be related to changes in metabolism and appetite. Antipsychotics such as olanzapine, risperidone, quetiapine, and clozapine are used to treat schizophrenia, bipolar disorder, and other psychotic disorders. These medications can cause significant weight gain, as well as metabolic changes like insulin resistance, type 2 diabetes, and dyslipidemia. The weight gain associated with antipsychotics appears to be related to an increase in appetite and changes in leptin levels, a hormone that regulates satiety. To minimize the weight gain associated with these medications, it is important for patients to be regularly monitored for weight, abdominal circumference, and metabolic parameters. Additionally, adopting a healthy lifestyle with a balanced diet and regular physical activity can help control weight gain and improve overall health. In some cases, it may be necessary to adjust the dose or consider alternative therapies with less impact on body weight. For example, newer antipsychotics like aripiprazole and ziprasidone seem to have a lower potential for weight gain compared to older antipsychotics. It is crucial that patients do not stop using these medications without medical advice, as abrupt discontinuation can lead to severe adverse effects and recurrence of psychiatric symptoms. 9. Diabetes medications. Sulfonylureas like glibenclamide and glimepiride are used to control blood sugar levels but can cause an average weight gain of 9 to 11 pounds. This happens because these medications stimulate insulin release, which increases appetite. Another example is pioglitazone, which can increase subcutaneous fat but also reduce liver fat. Sulfonylureas and pioglitazone are widely used for treating type 2 diabetes. They work by increasing insulin sensitivity and stimulating the release of this hormone by the pancreas's beta cells, which helps control blood glucose levels. However, these effects can also lead to weight gain. The increased appetite caused by sulfonylureas is attributed to hyperinsulinemia, a condition characterized by elevated insulin levels in the blood. Insulin is an anabolic hormone that promotes energy storage in the form of fat, which can contribute to weight gain. Additionally, hyperglycemia, low blood sugar, is a common side effect of sulfonylureas, and the intake of food to correct hyperglycemia can also lead to weight gain. Pioglitazone, a member of the thiazolidinedione class, can cause weight gain by increasing the differentiation of pre-adipocytes into mature adipocytes, leading to the accumulation of subcutaneous fat. However, pioglitazone can also have beneficial effects, such as reducing liver fat, hepatic steatosis, and improving insulin sensitivity. To minimize the weight gain associated with these medications, patients should be advised to follow a balanced diet, control portion sizes, and exercise regularly. Regular monitoring of weight and abdominal circumference is essential to detect weight gain early and adjust the treatment plan if necessary. In some cases, it may be necessary to consider alternative therapies with less impact on body weight, such as metformin, dipeptidyl peptidase 4, DPP4 inhibitors, or glucagon-like peptide-1, GLP-1 receptor agonists. These options can be discussed with the physician overseeing the treatment, taking into account the individual needs and characteristics of each patient. It is important to emphasize that despite the potential for weight gain, the adequate control of diabetes and the prevention of complications associated with the disease should be the main priorities in treatment. The benefits of glycemic control generally outweigh the risks associated with weight gain, as long as it is monitored and managed properly. 10. Insulin. Insulin is essential for treating type 1 diabetes and in some cases type 2. However, insulin can lead to significant weight gain because it is an anabolic hormone that allows glucose to enter cells. If this glucose is not used for energy, it is converted into fat. One study showed that diabetics who need insulin gain an average of 25 pounds in the first 3 years of treatment. Weight gain associated with insulin therapy is a common challenge for many diabetes patients. Insulin is a crucial hormone for glycemic control, but its anabolic effect can promote the accumulation of body fat. Additionally, the fear of hyperglycemia, low blood sugar, may lead some patients to consume more carbohydrates than necessary, contributing to weight gain. Several strategies can be adopted to minimize the weight gain associated with insulin therapy. 1. Insulin dose adjustment. The doctor can adjust the insulin dose to avoid hyperinsulinemia and reduce the risk of hyperglycemia, which can lead to excessive carbohydrate intake. 2. Blood glucose monitoring. Regular self-monitoring of blood glucose can help patients better understand how their body responds to insulin and food, allowing for adjustments in diet and insulin dosage. 3. Balanced diet. A diet rich in fiber, lean proteins, and healthy fats can help control appetite and caloric intake, minimizing weight gain. 4. Physical activity. Regular exercise can help improve insulin sensitivity, reduce the need for high doses of insulin, and promote calorie burning, contributing to weight control. 5. Patient education. Education about diabetes, including information on carbohydrate counting, glycemic index, and weight management strategies, can empower patients to make informed decisions about their diet and treatment. 6. Use of insulin analogs. Rapid-acting and long-acting insulin analogs can offer a more predictable pharmacokinetic profile and reduce the risk of hypoglycemia compared to conventional human insulins. 7. Adjuvant therapies. In some cases, the use of adjuvant medications, such as metformin or GLP-1 receptor agonists, can help reduce the need for insulin and minimize weight gain. It's important for patients to work closely with their doctors and healthcare team to develop a personalized treatment plan that considers their individual needs, including glycemic control, weight management, and overall quality of life. With proper support and appropriate strategies, it is possible to achieve good diabetes control while minimizing the weight gain associated with insulin therapy. 1. Thyroid medications. Medications for hypothyroidism, such as levothyroxine, are often used to restore thyroid hormone levels in people with hypothyroidism, a condition where the thyroid gland does not produce enough hormones. Although levothyroxine generally helps regulate metabolism and in some cases aids in weight loss in people who are gaining weight due to hypothyroidism, improper use or incorrect dosage can paradoxically contribute to weight gain. If the levothyroxine dose is insufficient to normalize thyroid hormone levels, hypothyroidism symptoms, such as slow metabolism, fatigue, and weight gain, may persist. This happens because, with low thyroid hormone levels, the body continues to function at a slower rate, using less energy and consequently storing more fat. On the other hand, an excessive dose of levothyroxine can lead to increased appetite and, if there is no proper dietary control, weight gain. Additionally, medication adjustments must be made cautiously because the hormonal balance is delicate and small variations can impact metabolism. It's important to note that weight gain associated with levothyroxine use is not directly caused by the medication itself, but by how the body responds to treatment, especially when the dosage is not optimized. Therefore, regular medical monitoring and precise dosage adjustments are essential to avoid adverse effects, including weight gain. 1. Serotonin antagonists. Serotonin antagonists, such as metoclopramide, are often used to treat conditions like migraines, nausea, and vomiting, as well as gastrointestinal disorders. While these medications are effective for controlling symptoms, they can cause weight gain in some patients, especially when used long-term. The weight gain related to these medications is associated with several mechanisms. One of the main factors is interference with serotonin levels, a neurotransmitter involved in regulating mood, appetite, and satiety. Serotonin plays an important role in reducing appetite. Therefore, when its effect is blocked or altered, appetite may increase. This causes some people to feel hungrier or have difficulty recognizing fullness, which can lead to overeating and, consequently, weight gain. Additionally, these medications can also cause side effects such as drowsiness and fatigue, which can reduce the willingness to engage in physical activities. The reduced activity level can contribute to fewer calories being burned, facilitating weight gain, especially when combined with an increased appetite. Another example of a serotonin antagonist is propranolol, a beta blocker often used to treat hypertension and migraines. Propranolol can reduce metabolic rate and, by lowering the body's ability to burn calories, may contribute to weight gain. Although weight gain is a potential side effect of these medications, it's important that patients discuss their concerns with their doctor before making any changes to their medication regimen. Conclusion: these are the 12 main medications that can cause weight gain. If you are taking any of them and noticing weight gain, never stop treatment on your own. Consult your doctor to discuss alternatives, such as dose adjustments or switching medications. Additionally, adopt healthy habits like engaging in more physical activities, paying attention to your diet, limiting sugar and fat intake, increasing fiber intake, and drinking plenty of water. I hope these tips help you maintain your weight or even lose a few pounds if that's your goal. If you liked the video, subscribe to the channel and activate the bell to receive more health tips. Share this information with friends and family and see you in the next video.